Right. So we're looking at the examples of risk characterization, like risk characterization, but we are focusing on severe respiratory disease. Okay. So risk characterization is simply, okay, we have a risk. They want to see if this risk is a low risk or medium, or it's actually a very high risk. You understand? So for the examples of risk characterization, for example, looking at the respiratory disease, we said that for an example event, a cluster of 22 cases of severe respiratory disease with 7 deaths in a country X was admitted to a hospital, and this was over the past 17 days. The event is occurring 8 kilometers from the border and cases have been reported from 3 villages by local healthcare workers. The area is actually the poorest in the country X and health infrastructure is limited there. Now, many of the healthcare facilities, they charge a consultation fee, and consequently, the local population self-medicates during mild illnesses because they can't afford the consultation fee. Okay, so there are also strong beliefs that strange diseases are caused by sorcery. So they also believe in witchcraft. So Rick's question: what is the likelihood of further spread of severe cases of respiratory disease, and what would be the consequences, that's type and magnitude, to the public health if this were to occur? So the information used to access the likelihood of further spread is this: cases are being reported 17 days after the first known case. That will tell you that there's a possibility of this disease condition still being on the rise. The specific hazard, that's modes of transmission, have not been identified, so it's not fully understood. It is also likely that some cases have not been dictated. All right, maybe mild cases, some people still have it but they are not actually showing symptoms, so they are less likely to seek care from the health services and are therefore not included in the official report. Conclusion: it is highly likely that further cases will occur if nothing is done. Okay, so this is how you can be able to characterize risk. Okay, and this in view is a respiratory infection that's affected a place in the example.